So I am very thankful to Dr. Pratap Jethwani and Dr. Rutul to give me this very, very important topic. And the topic is what RSSDI can do to improve diabetes care at the rural level. So let me tell you, this comes from the background of RSSDI National Rural Outreach Program, which we are going to launch tomorrow in Lucknow in the presence of the RSSDI national body, Dr. J.K. Sharma, Dr. Sanjay Agarwal. Everyone is going to be there along with Dr. Anush Maheshwari and our president, Dr. Vijay Vishwanathan. I'll put this number on the slide just to show you that in 2000, in the year 2000, we were 32.7 million people living with diabetes. And this figure is from the IDF Atlas of Diabetes, which was just recently released at the IDF Congress in Bangkok. And it predicts that in 2050, we are going to be 156.7 million in numbers when it comes to the number of people living with diabetes. What is more disturbing is that if we compare the growth in the number of people with diabetes in our region in comparison to any other region in the world, what we see is that our neighborhood, that is China, will only increase by 20 million in next 25 years. But right now we are somewhere around 90 millions, but we will reach to this 160 million number in another 25 years. So our neighbor is able to put some brakes when it comes to curtailing the rise in diabetes, but we are not able to do so. So are we missing something? Do we need to do something at the ground level? So thinking about this, RSSDA thought about launching a RSSDA rural project, and a lot of people, they are doing some activities in different parts of the state over the last few years. I will show you some of those activities. So we know that the prevalence of diabetes is increased in both rural as well as the urban areas. If you look at the data from the 1972, it was 2.4% and 3.3%. And if you look at the data now, it is 15% and 19% respectively from 2015 to 2019. So similarly, there is increasing prevalence, which is seen in both pre-diabetes as well as in both the genders. But if you look at the number of the people, if you look at the rural population, so rural population is gradually declining because of the urbanization happening. And urbanization, I believe it is not simply the migration. Now, even the people living in the rural area, classified geographically, they have access almost to each and every facility which is available in an urban area, whether it is in terms of type of food or in terms of type of entertainment or in terms of anything. So they don't need to move to go a very long way to afford to take all these facilities. So even if the geographical migration is happening, the number of people living in the rural area is declining, but cultural urbanization is happening very fast in the rural areas. And if you look at the population distribution, you will find that by 2050, it is projected that we will be having a 50-50 percentage people living in rural as well as the urban area. And these findings are from a systemic review of a pool of 23 studies on prevalence of diabetes in rural India. And there is data starting as early as 1994 to 2009, and you will find different prevalence rates of diabetes in rural India. Again, the prevalence of diabetes in rural area was between 5.5 to 6% in 2010, but it is rising sharply. But it is important to look at the data from the Dr. Mohan study, that is the ICMR INDIAB National Cross-Sectional Study. And if you look at the overall prevalence of diabetes in India, it is 11.4%. And if you look at the urban prevalence, it is 16.4%. And rural prevalence is at 8.9%. So overall prevalence has topped 100 million, but still you can see there is a urban-rural divide. But what is more important if you look at this data is that if you look at the number of the prevalence of pre-diabetes, so overall prevalence of pre-diabetes is 15.3%. In urban, it is 15.4%, while from the rural, it is again equally, you can say equal number of equal prevalence even in the rural area, that is a 15.2%. So there is a 170% rise if you look at the number of people living with pre-diabetes. So pre-diabetes is rising sharply, so that means very soon we will have tsunami of people living with diabetes in the rural areas as well. So if you look at this slide is from the IDF Atlas 2024, and you can look at the regions. If you look the Africa is growing at the fastest rate at 142%, which is not a nice thing, followed by the MENA region, and then the Southeast Asia, which is 73%. So rise is happening in the Southeast Asia region. So viewing our nation through a fresh lens and a renewed perspective, there are bright spots as well as the challenges, and I am fortunate that RSSDI has now started this campaign, and we are now trying to reach out the rural communities with a dream of reaching 1,000 villages in the next 1 year. So this is one of the statements that the key to enduring health lies not only in the cure, but more importantly in prevention. And that is why I think this session in the very first part of this conference, that is the basics of diabetes. So our responsibility is not just to treat diabetes, but also to reach out to those people and tell them that what are the risks of developing diabetes, how we can prevent diabetes. So this is again the important part of our medical profession. So this was thought behind this was the thought behind the genesis of the RSSDI Rural Outreach Program, because a large number of people still live in villages. So one such initiative was taken years ago, and this was the Kuchaman city in Rajasthan, where diabetologists from Ajmer and Jaipur, they visit the village regularly, and this village project was launched again by Dr. Bansi Sabu, who you all know very well, and this village is situated in Kuchaman city. So regularly there is a visit of doctors to this village, and all the facilities which you provide at any urban center is provided at such a center. So the model also introduced a mobile clinic. So there is a mobile clinic also which goes to the village on specific days. It is the way to reach out to the people, to the community, rather than people reaching out to the doctors to manage and educate communities with diabetes. So if you find people are not able to go to the cities for better care or the prevention, then we reach out to them. This is the main goal of RSSDA Rural Outreach Program. Another important project is happened in Telangana, that is the Telangana Village Health Projects for Diabetes. And this project focused on training of healthcare workers, both medical as well as the paramedical training, and creating more awareness about the diabetes. And the outcome results of this project are still awaited. Let me get you some insights from the Uttar Pradesh. And why Uttar Pradesh? I know the Gujarat has given the Gujarat model of governance to the country. So probably the Uttar Pradesh by far has done one of the main work in the field of diabetes in rural area. And you can get some insights from this project, because I will request all of you to join this project, because we just circulated a Google form 3 days before. And let me tell you, in just 3 days, we have received more than 250 self-nominated members of RSSDI. Some of them are known members who want to be the part of some RSSDI village program, and they want to go to some village. And this has just happened in last 3 days. So why Uttar Pradesh? Because if you look at the Uttar Pradesh, it is one of the most populous state of the country, and more than 16.5% of the population of the country lives in Uttar Pradesh. And if you look at the prevalence, there is you will be surprised to know that while the average national prevalence of diabetes is 11.4%, the prevalence of diabetes in Uttar Pradesh is only 4.8%. So you will say that Uttar Pradesh is doing very good because there are less number of people living with diabetes. But this slide will remove all the misconceptions, because you will find that the prevalence of pre-diabetes in Uttar Pradesh is around 18%. So it is much, much larger, greater than the national projections. So that is why we think that if there are reversal opportunities, there are more in states like Uttar Pradesh, where even the ICMR in study projects that the prevalence of pre-diabetes is around 18%. So what is the UP model of RSSDI village or the community adoption program? So you do initial survey of the village, check the blood sugar, identify the people living with diabetes, identify trained personnel. Health education and awareness programs are conducted in the rural population. The prevention of diabetes and also training for self-care of diabetes. Glucometers, they were distributed. Monthly 10 glucose strips were given for regular monitoring. Blood pressure was monitored. Tests for neuropathy, nephropathy, and retinopathy, and the other camps, they were done on the annual basis. Time to time visit by the RSSDA UP was ensured, so that follow-up was not lost. And the referral to the nearest health care centers for the refractory patients was given. And one of the important points of this project was that no drug distribution was given. So when we go out to the community, we are educating the community, we are strengthening the local healthcare system. If some doctor is there, we are trying to tell them about the RSSDI guidelines. We are making them more, we are empowering them to manage diabetes in a better way. But we are not interfering with the ecosystem by giving drugs, and we are not distributing the free drugs, because then what happens in most of the camps, the people will only come for the drugs, and the rest of the things, they take the backseat. So this is one of the important component of the project. This is just to show you that these are the few villages, and I will also show the data that what has happened in these villages. So these are some of the photographs of these villages. You can see that distribution of the glucometers, and the training of on the self-usage. You can see Dr. Anush Maheshwari, who is the president-elect of RSSDI, doing the groundwork, doing the HbA1c testing, measuring blood pressure. So I am showing all these pictures because when you plan to go to a village, you can also think of doing all these activities, running health education programs, conducting blood sugar camps. And this is again, no distribution of medication, you can see. And incorporating yoga as well as the meditation, because now you know these are again the UN callings. Now we have a World Yoga Day, now we have a World Meditation Day. So these are the practices which can also be incorporated. Again, these are the pictures from the different camps. And if you look at the assessment of the impact, I would just like to mention the three villages. You can see the Kevdi, Mubarakpur, and the Safidabad. You will find that the blood glucose level in 2009, if average blood glucose was 168, then in 2023, it was 124, 128, and 154. So you can see there is a perceptible decrease in the average glucose level of the village population. And if you look at the initial intervention, within the few months of the intervention, when you go to these villages and talk to the people and conduct the test, you can see there is sharp decline in the average glucose level. And after some time, it was seen that the glucose levels, they stabilize and no further improvement is seen, because probably we need to rethink of some more strategies that how we can make it better. But in one of the villages, probably the follow-up was not able to, we were not able to follow properly, and there was a COVID time as well. So there was loss of contact with the people. So probably that is the rise that initially you are able to achieve a decline in the glucose levels. But again, if continuous activity is not there, this slide shows that these people may again have deranged glucose levels. There was another activity. So recently, last year, another village was adopted in Ramnagar, Varanasi, which is the constituency of our Prime Minister, Dr. Shri Narendra Modi ji. And the village project inauguration at the Ramnagar, Varanasi, Dr. Jitendra Singh, our Minister of Science, also gave his message, and he endorsed this project there. And you can see some of the screening in Ramnagar, Varanasi, that how it is conducted. Recently, last year in the month of August, we adopted a village in Gharbara in Greater Noida, and IDF President Dr. Peter Swartz was also present in that village. And these are the different activities. And this picture is, I think this is one of the historical picture, and you can see Dr. J.K. Sharma, Dr. Sunil Gupta, Dr. Bansi Sabu, and some of the stalwarts of the RSSDI, where the first village adoption was done in Kuchaman city. Dr. Dheeraj Kapoor sir is also sitting. He was also there, I guess, I believe. So this is another pictures from the Greater Noida and the Varanasi. So this is the survey form which we just circulated. So in 3 days, we got 229 responses. And 83% of the people, they are RSSDI member, doctors, and the rest, they are not doctors, but they still plan to join the RSSDI. And when we ask them that, have you ever been to community? So this is very, very important, that almost 62.7% are doing some kind of community service, but probably that is not getting recognized, or they are not getting some kind of SOPs that how to do it. So RSSDI is going to help them that how to do it. And another interesting finding is that almost 40% of the people, they have never been to community service, but they want to join the RSSDI community health project. So this is very, very important. So what we can do is that charting a path forward, you can think of less diabetes prevalence, maybe because of more rural population, the largest growing state of India in Uttar Pradesh, but huge young population may be at risk. So these are the future perspectives which I would like to share and conclude. So community health programs, local language resources, train local healthcare workers, promote medication adherence and regular follow-up. Think of mobile and home screening camps. Also try to involve ASHA workers at the grassroots level. Telemedicine, culturally tailored diet counseling, physical activity programs, engaging local influencers, affordable medication programs, and the peer support group. So these are some of the things which are in the agenda of the RSSDI to promote at the RSSDI Rural Outreach Program. And this is the program which is going to be launched tomorrow in Lucknow with the national launch of the RSSDI Rural Outreach Program. So with this, I would like to thank all of you and summarize by saying that you are doing amazing work in your clinics, in your hospitals by managing diabetes. And many of you are going to also doing community service at the village levels. But if you look at, get connected with the RSSDI, try to find out what RSSDI is, what are the SOPs of the RSSDI. This will make your outreach program more effective and together we can make an impact at the rural diabetes prevention. Thank you very much.